Basically, I would just like Darren to make me a younger version of myself. I feel that I'm getting a little bit tired, so I just want to be freshened up.
I completely understand that you want this to look completely natural and you don't want to look like those women with the stuck-on cheeks. So everything that we do today is going to be tailored to that objective. I think the first thing to point out about your face, and this is what stands out about me, is that you've actually got really lovely full cheeks as they are, okay? So we need to be careful when we're addressing the cheek. You can start to see here again the sort of impression of that volume loss right there in the midsection of the face. So we will go in there, but I'm not going to come up over the cheekbone at all. The jaw line, we're going to have to do quite a bit of work down here. So as you get older, your entire jaw shrinks. So people always think of facial aging as being a process that involves skin and soft tissues, the fatty layers, but actually the whole facial skull changes as you get older. And the bone of the jaw gets much smaller and it goes up at the angle. So I'm going to spend quite a bit of time and work down at the angle of the jaw trying to restore the definition. Now, one of the things that we talked about when I saw you for consultation was that you felt that your nose had a bit of a bump on it. Okay, this is actually what I would call a pseudo bump, okay, which means that it looks like a hump on the nose, but actually the biggest issue is that there's an indentation up here rather than the bump there. So I'm going to fill into that indentation up here, which is going to create the illusion of the nose being a bit straighter, and it will actually ironically make, although the nose will technically be a bit bigger, it's actually going to look a bit smaller. And then the last thing that we want to do is just restore a bit of a more youthful shape and projection to the lip area. Okay?
Excited?
I'm excited for you.
Me too.
I'm going to start off just by using a special antiseptic face clean. And the reason for that is that the possibility of developing a late onset reaction is much reduced by using this particular type of antibacterial skin prep. It's this hollow right here in the mid-face that I want to address, but without coming anywhere near Rhiann's cheekbone, which we've already decided is broad enough. We want to take away the saggy indented bit, but without broadening the cheek and creating a stuffy cheek look for her. So with this, I'm going to inject it directly on top of the bone, and then I'm aspirating to make sure that we're not sitting inside any important blood vessels. Aspirating is just drawing back on the syringe, and if you've inadvertently inserted your needle into a blood vessel, you would get some blood coming back into the syringe filler. Just done the first injection on the cheek on that side, and if you can see that that side already looks lifted and less tired and saggy than that side. So that's literally the first injection, only one injection, and already you can see the difference that that makes to the cheek. One of the most important aspects of facial aesthetics is taking into account the patient's own individual anatomy and doing something that's really different for each person. One of the mistakes that a lot of people make is that they do the same thing for every face that comes through the door, and it might work for some people but not for others. So generally, someone of Rhiann's age, I could easily use 5 or 6 syringes of filler just in the cheeks, but for Rhiann I'm only using 1. I'm probably going to use a lot more in other parts of the face, but for the cheeks, any more than that is going to be too much. Now I'm going to come down and work to restore the angle of the jaw. In this scenario where Rhiann is quite deficient, so I'm probably going to inject quite a lot of product down here. But that tip of the needle sitting directly on top of the bone, okay, under the jaw. I know that the facial artery comes into the face somewhere over around here, but I've aspirated anyway. Even though I should be miles away from that artery, I'm aspirating anyway just to be extra sure that we're not going to cause any vascular complications. So yeah, people always focus on the skin and soft tissues and the effects that aging has on that, but actually for some people It's less about the skin and soft tissues and much more about the bony shape of the face. I was just walking the needle along the bone there until I got onto exactly the right spot. Rianne's got quite a wide face, and I don't want to widen the angle of the jaw, which would start to make her face look more masculine. It's literally the angle of the jaw that I want to drop back down from being up like that to closer to what it would have been 20 years ago. If you just have a look at the side of the jawline, you can see that it's starting to take a nice, sharp, defined look back. I'm going to move down to the chin next. I'm going to build up this area in between the lip and the chin to help push the lip back up the way. I'm going to put some down here to bring the chin down the way, and then I'm going to work on the marionette lines. In this area, I'm moving away from injecting on top of the bone, so that I'm going back into the fatty tissue. So I'm going to use one of these little blunt cannulas. When the cannulas first came out, I used to use them for injecting every part of the face because they cause less bruising and swelling. But actually some parts of the face are better with a traditional needle. So I now use a combination of needles and cannulas depending on what I'm trying to do. So I'm building up the chin, and can you see that the corner of the mouth here is starting to turn up the way in comparison to that side? And I haven't actually come anywhere near the corner of the mouth yet. All I've been doing is building up this crease in between, or the sulcus doesn't really have a crease, but the depression and volume loss in the lower lip, not just in the red part of the lower lip, but all the way down towards the chin. And when you build this back up, it starts to create a support structure for the corner of the mouth as well. So here I'm using Juvederm Voluma, which is a really nice, thick product for injecting deeply that's good for creating support and structure. The next injection that I'm going to do is going to improve the projection and definition at the bone of the chin. When I'm doing this injection, it quite often feels as though I'm giving you a big chin. I promise I'm not giving you a big chin. It just feels weird. Okay? Again, down on top of the bone. Being careful because we've got that little neurovascular bundle there that we just don't want to inject into. Thought after we've done all the work in the cheek and the chin and the jaw, that should take away most of the droop. And then just whatever's left, we go back in that with a little bit direct into the folds. But the way that people used to use fillers was just to keep on filling these until they were all gone, and it just made people look too stuffy around the mouth. It makes it look obvious that they've had something done. So I'm now quite happy with the shape of the chin, jaw and cheeks. And I want to start looking a little bit more up the upper part of the face. The skin up here is a little bit thin, so I'm going to use a really soft filler just above the brow, under the brow, and then a little bit into the junction between the eyelid and the cheek to try and disguise the appearance of the bags and to blend the junction between the lid and the cheek. Then we'll do the nose, and then the last thing we'll do will be the wee bit into the lips. Depending on the shape of the nose, I quite often like to come in with a cannula from the tip of the nose and go straight up, so I'm only making the one entry point. Because of the shape of Rianne's nose, because the hump is down here and the deficit's up there, it's going to be quite hard to get a cannula from there smoothly over the bone and staying in the right tissue place. So for Rianne's case, I'm going to use a needle and just inject directly down on top of the bridge of the nose. So we are building up the root of the nose so that the bump looks less obvious from the profile view. Now that we've straightened the top part of the nose, the tip of the nose is starting to look a little bit droopy. So I'm going to actually just put a little bit into the tip as well to lift the tip. For filling our Rianne's temple, normally I would use Voluma up here because I usually need quite a lot of augmentation, but I'm actually using Facelift today, which is a much thinner product. I was going to try and get away without putting anything in her temple because again I want to avoid giving her a full face or a fat face. But the quality of the skin up in this area was just a wee bit poor and crepey and starting to look a bit out of sync with the rest of the face now, so I'm using small amounts of a really fine product just to make the area look a bit softer. And now I'm going to inject onto the eye socket bone, again really small amounts, but it just helps to soften the contour of the eye. So I'm going to do these wee lip injections next. Okay. This is going to be the most uncomfortable bit.
Right, is this going to be sore?
A wee bit nippy, yeah. If you find it too painful, we can give you a local anaesthetic. When I'm injecting the filler into the lip, I'm trying to get it into a very precise tissue plane. I don't want it sitting in the muscle, I don't want it sitting in the skin, I want it sitting precisely between the two. And the way that I do that is by getting the tip of the needle sitting in a potential space between the muscle and the skin, and then injecting. And if I'm in the right place, the filler just flows on its own without me having to insert and withdraw the needle. And if I don't get it in quite the right place the first time, I withdraw and go back in until it's in exactly the right space. And that way it means that when the lip moves after this, when this has had a chance to settle, you won't be able to see that sort of lumpy, unusual look that you sometimes see in girls who've had lip filler. She'll just have a little bit more shape and definition. From profile, the lower lip still projects a little bit in front of the upper lip, so I'm going to do an extra couple of injections in the top lip to try and bring them into a little bit better harmony. And then I'm just going to finish off tidying up a couple of little indentations around the lips, and then that's us. So just now you get a little bit of redness, a little bit of puffiness. The lips look a little bit overdone, which is exactly the way they should look at this point.
Oh my god, that's amazing. Look at my nose. Oh my god, look at my neck.
Yeah, so because we built up the jawline quite as much, so look at the shape coming along the jawline now. When you build the jawline up, it also helps to improve the neck a little bit. We have built up the nose, both at the root of the nose, and actually after I had built this up, the tip started to look a little bit droopy. So I've injected a little bit into the tip as well. We've had a little bit into the cheeks, but a really small amount just to take away some of the droop that we were starting to see here. And then most of the work we've really done along the angle of the jaw and at the chin. And when we've built up the jawline, it helps to create a much more youthful shape to the face. And again, the lips are a little bit swollen just now, but you can see instead of them wanting to turn in the way, we've now managed to get them so that they want to turn out.
It's unbelievable, it's absolutely wonderful.
For Rhianne today, I've used a total of 12 syringes of filler on her face. It's quite often when you mention 12 syringes of filler, sometimes they'll use more than that, 15 syringes, 20 syringes. When you talk about these kind of volumes, it makes people really anxious because they assume that they're going to end up with a trout pout or look really false and unnatural. But it's all to do with where the filler is positioned. And so long as we get it in the right places for the right face, it can actually be really powerful in rejuvenating the face without creating any sort of unnatural look. You can see that although we've done quite a lot of work today, she could easily go back out on the street and nobody's going to look at her and think, oh my god, you've just had a whole face full of treatment done. But when this has had a chance to settle in, the redness has had a chance to settle and Rhianne's got her makeup back on as she normally would, this will look even better.
I'm absolutely delighted, thank you.
Very welcome.
Thank you. Oh.